Hey, it's Coach Mark, and I'm here to bring you some tips to try to help you relieve some elbow soreness, really some common injuries or aches, pains that we refer to as tendonitis, whether it be golfer's elbow, tennis elbow, soreness that you're feeling on the inside or outside of that elbow joint related to inflammation of the tendons in and around that elbow. So a lot of times it could be result of overuse, some type of repetitive stress, gripping, lifting, sport play, racket play, tools, things like that. A lot of times it's also because of increased stress and tension throughout that forearm area, but it's also can be caused by some weakness in the hand, in your grip, and the muscles in your forearm. So some tips on how you could possibly relieve that elbow pain with some self-care. We can do some stress and tension relief with just some soft tissue massage. If you're able to really just rub the forearm, get some blood flow and circulation going through there, right? You could do some active range of motion where you're going to flex and extend that wrist up and down 10, 15, 20 times. You can turn that hand over and what we call ulnar and radial deviation. You can bring that wrist up and down again 10, 15, 20 times. And you can go in circles. You can go in both directions, clockwise and counterclockwise, again 10, 15, 20 times. You can work on some stretching where you're going to extend your arm straight. Get a hand on the opposite hand and pull towards you. You should feel a light stretch underneath the forearm on the bottom side. You can keep that arm extended, point that hand down, bring your hand on top and gently stretch down, and you should feel a stretch on the top side. So with those stretches, I would try to hold for a 5 count, 1 deep breath in and out, relax, shake it out. And you can do 5 to 10 repetitions in one direction, 5 to 10 in another direction. You can even alternate, right? But feel the muscles stretching out. So in terms of relieving stress and tension, again, some massage and stretching and just some active range of motion or mobility. In terms of increasing the strength throughout your hand, wrist, and forearm, a couple things you can do. You can do some wrist curls, get yourself a light dumbbell. It could even be something like a soup can if you don't have a light dumbbell, but you can support yourself over the edge of a table or a countertop, and you can work on curling up, and then more importantly, controlling that descent down, right? Curling it up and controlling it down. If it's a little bit heavier of a weight, you can use the opposite hand to help pull it up, and then, like I said, lowering it down in an eccentric fashion. Same thing if we're gonna bring it over the opposite end. If you can curl it up under control and then lower it back down. If it's a little bit heavier, use both hands to help guide it up and then control that weight coming down. So you should feel the muscles in the forearm working. We can also do some simple grip strength, right? You can use a stress ball, a hand gripper. You can use a rolled up pair of socks. You can use a hand towel, right? And it can be one hand at a time, it can be 2 hands at a time, but grip strength is super important, correlated to longevity. So the stronger we are, in our hand and grip strength, the better chance we have of being healthier later in life. And so again, just trying to squeeze at least for a 5 count, relaxing, maybe 10 repetitions. You should feel that throughout the forearm as you grip, squeeze, and release. Now, another way that we can do isometric strength training here at the Ultimate Wellness Lab, we have a program called IsoStrong. We use this IsoFit platform, and we can get into different positions where we're actually going to grab this bar and increase our grip strength along with strengthening other muscles in the body. So if it was something like a bicep curl, we would be able to grab that bar, squeeze it as hard as we can. As we're trying to curl that bar up, it's not going to move on it, but we're increasing that grip strength. We can come into different positions, whether we're seated or kneeling down, lying down, whatever it may be. As long as we can grab that bar, grip it and squeeze it, and pull or push towards us or away from us, we're going to be able to increase that grip strength with the isometric hold. So things that we can do, that you can do at home, so soft tissue massage, mobility drills, light stretching, dumbbell curls and isometric strengthening, and things that we can do for you here at the lab. Our Smart Stretch Therapy to try to help relieve the stress and tension in your forearms and other muscles, and our IsoStrong program to help you increase that grip strength and overall isometric strength throughout your body. So if there's things that we can do to help you, don't be afraid to reach out. Happy to help out.